So these are the parts of the paper. Whatever we did up till now was the method section. We did collected the data, screened the articles, and did the quality assessment. That was a part of method section. Now our next step is to write the result and discussion section on the basis of your finalized articles. And then conclusion is only the summary of your discussion, and introduction is background of your research topic, and abstract is we write abstract at the end because it is summary of whole of your paper. So right now in this lecture, our topic is results and discussion. So in results section, one is Prisma flow diagram that shows your research strategy, how many articles you had, how many you excluded, and why you excluded them. You have to tell the reasons. It makes your paper more reliable, and you have to tell why you included certain articles. If you write the reason that I included randomized control trials for this reason, or I included observational studies for this reason. For example, there are two randomized control trials, but they were not enough observational, enough systematic reviews in observational studies. So my aim was to analyze the observational study. So if you write the reason, then it makes your paper more reliable. So Prisma flow diagram that I told you in the previous lecture. So this is the abstract that we write at the end, and keywords and introduction we will cover it in our next lecture, and then method. So Prisma checklist was used, and then your inclusion and exclusion criteria, your data collection strategy. This table is not mandatory. It's up to you if you want to include it or not. And if you don't want to include the table, then you have to write all this in the form of a paragraph. And then study selection, how you screen the articles and how many are finalized articles. And then risk of bias, which tool you used for assessing the risk of bias, and then risk of bias table, and then finalized articles. This is the method section. So in result section, you have to tell that you had the total number of studies, like whatever you would write in Prisma flow diagram, 472 remaining after duplicate removal, and then you screened through titles and abstracts, and 15 studies were selected, and you did quality assessment, and 12 studies were selected after quality assessment. So in Prisma flow diagram, you have to write the number of databases you searched, and number of articles in each database, records, duplicates removed, records screened after duplicate removal, and excluding on the basis of titles and abstracts on the basis of full text articles. And if you have excluded for other reasons, for example, if there's only abstract or other language study, or not full text article available, or if you are only including observational studies, then exclude RCTs. At this level, you have to have all the studies that are up to your PICO criteria. So your population is the patients that you are studying is your population. For example, if MI patients, you are studying acute MI or chronic MI, so your population is MI patients. So if you are studying cerebral palsy patients, then your population is cerebral palsy. Intervention is whatever the drugs you are studying. And comparison drug is if you have any comparison drug. If not, then you can have a comparison to a standard drug. Standard treatment is the treatment that is now being used as a standard. For example, if you are researching about stem cell therapy, then you would compare it with standard treatment that is being used right now for MI. So at this level, you would have all the articles that are up to the PICO criteria, and then if all the articles that you would exclude, you have to tell the reasons. For example, they were RCTs and you are not studying RCTs, and they were not English language articles, or whatever the reasons, you have to add them here. So in result section, first is Prisma flow diagram, and then total number of studies, and total number of patients in all these studies and male and female ratio, and the intervention you are studying, and the dose of the drug. So second is the study characteristics that I was just telling you right now. Uh, Now, for example, you have 10 articles or 15 articles. So you have to open each article and note down the number of patients, gender, intervention or drug studied, follow-up period. You have to open your paper and assess the patient characteristics and study characteristics on the basis of your own paper. This is not mandatory. This should be present because it depends on your own paper. For example, if you open up this study, this is demographic and baseline headache characteristics. So number of patients 164. Uh, Intervention is Inumab. Dose is 70 milligram, and outcome that is being studied is headache impact test 6 score, and 135 female. And then you can find out the male number of males by subtracting from 162. And then failed preventive treatments 8.4. So you would read all of these and you would make a table in which you would write number of patients and then intervention, dosage, outcome studied, and treatment failures, and then follow-up period. Observation period 6 months, and if there is any follow-up period, then you can write follow-up period. You can also add funding in this as well. So look at this. This is the study I told you. You have to write the name of the first author, it, al, and year of the study. You have to arrange articles on the basis of old to latest, or latest to oldest, whatever you want. And here you would make columns. For example, number of patients, year of study, previous treatment failures, gender, follow-up period, or total observation period. Outcome study, treatment discontinuation. You would choose these headings on the basis of your own paper, whatever you want to include or you don't want to include. So the headings that are common in all the papers, you would include them. So in result section 1 is the study characteristics of all of your finalized articles. So this table would have the characteristics of patients and all the study characteristics, and then study outcomes. For example, this one is a table for study outcomes. This is the study, and it discusses the monthly migraine days and monthly headache days and MIDAS. It doesn't talk about MIDAS score, but HIT6. So if one study is talking about these outcomes, then you would just write these outcomes and leave it empty. This study only talk about monthly headache days, so you would only include this one and leave all rest of them empty. So this study talked about monthly migraine days and migraine disability assessment and headache impact test. So you would analyze what outcomes are being studied in each of the paper, and then note them down, and then you have only write the conclusion in one line. So you don't have to write your own assessment. You have to write what paper, or for example, mean reduction in MMD at 3 months for 6 days. That was enough. You don't have to write all this detail. So you just have to write the a little summary. So you don't have to write this detail. You can just write mean reduction and MMD at month 3 was 6 days. For example, if you are studying MI and ejection fraction, so you have to write the result, that how much it was improved or not improved. So this is the study outcomes, and this is your results section. In the results section, you also can have a summary of all of your studies. If there are no different outcomes, so you can just have the name of the studies, first author, year, and then summary of the result of each study. And this is your result section. Your Prisma flow diagram, study characteristics, and study outcomes. So before each table, you can write a paragraph about study characteristics and then make a table. And similarly, for study outcomes, you have to write a paragraph about the study outcomes and then result of the studies in the uh, table. So this is your result section. And then discussion. Discussion is very important. It includes 50% of the paper. And in discussion section, you will compare papers with each other. In original articles, like randomized controlled trials, observational studies, you compare the drugs with standard treatment. But in review articles, you compare the papers with each other. So how to write a discussion section? You have to read your papers and then select 2 to 3 subheadings for writing your discussion section. For example, if most of your papers are talking about mechanism of action and pathophysiology or system involvement, whatever it is, you have to divide it into subheadings and then you have to write your discussion section on these subheadings. Or for example, efficacy of the drug, comparison to standard or comparison drug if you have any comparison drug, and safety and tolerability or adverse effects. You can also make a table of adverse effects, write the name of the study and then adverse effects in that study and then second study adverse effects in that study. So you can also make a table of adverse effects. And you have to make subheadings. And after making subheadings, you have to start writing your paper discussion. So when you have chosen your subheadings, then you have to divide the papers. For example, study 1, 2, 3. You have, for example, 9 total articles, and 3 of them talk about mechanism of action, and 4, 5, 6 talk about pathophysiology, and 7, 8, 9 talk about systems involvement. Then you have to write a subheading. For example, you would write mechanism of action of this drug, and you have to cite paper one, the results of paper one, then results of paper two, results of paper three, and it's done. Then you would give second subheading pathophysiology and then discuss the results of paper 4, 5, 6, and then you would give the subheading of systems involvement and discuss the paper 7, 8, 9. But if, for example, you are studying efficacy and safety of a drug and all the articles talk about efficacy and all the articles talk about safety, then you can mm, talk about all of those articles. This is not mandatory, but if a few studies talk about one thing and other studies talk about other thing, so then you can divide it like that. You have to organize your papers according to the year. For example, when you made a subheading and you are talking about different papers, then first you can talk about the latest study and then you can go backwards to the older studies. So you have to divide your papers from latest to oldest and then talk about them on the basis of their how recent they are. So first you will write a little introduction of all of your studies that, for example, you would write your objective. This section explores efficacy and safety of adalimumab in 2,427 patients. This is the total number of patients in all your finalized articles across 12 cohort studies. And then analysis focus on several key metrics. This is the outcomes. For example, reduction in monthly migraine days, monthly headache days, headache impact test score, migraine disability assessment score, and overall quality of life. So these are the outcomes you are studying. And this study encompass episodic and chronic migraine patients and follow their progress over varying duration. Few studies are over 3 months, 6 months, 12 months, and 2 years. These are the study characteristics in a paragraph. And a significant proportion of participants are women, reflecting well-documented demographic prevalence of migraine among women. So this is all that you would exclude. You would exclude some statements from the article. You can underline them when you are reading the article, and then you can write it in your discussion section. And then what is the 7 milligram of adalimumab, and in few studies 150 40 milligram, and so you would discuss your PICO criteria, your population intervention comparison outcome, and so this is your introduction. And these are the subheadings. For example, efficacy, and then you would write the results of all the articles under this subheading, and then you would give the citation. You would put the reference here. After each line, other than the introduction, in the introduction of the discussion, when you are talking about the results of the studies, you have to have a reference after each line. So there should not be any line where there is no reference. Even when two lines are taken from the same study, for example, if this is from the article 13 and this is also from the article 13, then you have to put your reference at both places after each line. You cannot have it after two lines if they are from the same study. So, and second subheading, for example, conversion from chronic to episodic migraine. So if there are two articles discussing about that, then you would cite them here. And safety and tolerability. If most of the articles are talking about it, you would talk about safety and tolerability. For example, 13 and 16 are talking about treatment discontinuation. You would give reference of both of these articles. Mild adverse effects, for example, constipation, fatigue, nausea, flu-like symptoms. And study 14, 18, 21, 22, all of these all of these said these adverse effects, then you would give reference of all of these. I will tell you later on how to put these references. Right now, I'm just telling you how to add the discussion. So I also told you that you can also make a table of this adverse effects if you want to, and write a summary of the adverse effects and make a table. And then limitation. So limitation are actually the your exclusion criteria. For example, it includes only English language articles, which exclude relevant studies published in other languages. It does not incorporate gray literature, overlooking important unpublished data. And since you have only observational studies and no controlled trials, and it affects the generalizability of the findings. So whatever is your exclusion criteria, you would make it a limitation and write it here that I have only English language articles, so we missed the data in other languages. I only included randomized controlled trials, so missed the articles in other articles. So whatever is your exclusion criteria, you would write it as a limitation. So this was your discussion, introduction, then body of discussion section in which you would have your subheadings and then limitation. You have to mention the chosen studies under each heading if you have divided them. And then you have to rephrase the relevant points of the study. I would tell you how to rephrase and write it in your article. And then you have to rewrite it again, paraphrase and rewrite it again, and then interpret the results and compare the studies with each other. So these are the standards for writing the discussion section. Characteristics of individual studies that I already told you, like population, number of patients, inclusion and exclusion criteria. So when you make a table of the study characteristics, you can also write inclusion and exclusion criteria of each study. And then strength and limitation of each study. You can also add this in the table, strength and limitations, or any bias and flaws in your finalized articles, relationship between individual studies and relevance of studies to population comparison, intervention, etc. So this is the standard for writing the discussion section. You should have at least one table and one figure. Here one figure is Prisma flow diagram, and one table should be the summary of the articles or summary of the outcomes in each study. Maximum you can have 5 table and 5 figures. One table that you should have and is accepted in all journals is the summary of all studies. So description of the table comes at the top and diagram comes at down. For example, this is the table, and you would write it at the start, the description table for study outcomes. And if you are using any abbreviations, you have to write the full form. So description of the table is at the top, and then this is diagram. Description of the diagram is down at the bottom. Flow diagram for screening and selection process. Other than Prisma flow diagram, if you have to add any figure, you have to make your own figure on Word or any other Microsoft software. If you take any figure from internet, you have to take permission from the author, otherwise it would have plagiarism. And limitations that I already told you, it is basically your exclusion criteria. These are the research writing tools that you would be using for writing your research paper. One is Mendeley. So you have to go to Word, add-ins, and Mendeley site, add it here. Now you have to open Mendeley, download the Mendeley app. And then these are the already articles. So this is Mendeley, and from here you have to add references. So I told you that you have to download all the articles and then you can save them in one folder. Or you can also add one by one. So if you have them in folder, I had to add a folder. So let me do it again, import folder. So you would have all your articles uploaded on here. So these are the articles. Now you would go to the Word and you would have all your articles here. So for example, you have let's go to the discussion section. For example, you took this line that MMD and MSD decreased compared to baseline. And also the total number of days required for body therapy intake were decreased. And you took this from this article. Then you have to citation settings, choose the Vancouver style. It's already Vancouver. Also, you have to insert bibliography and then add the reference. For example, go to references and you took this line from this article, then you have to click on this and insert one citation. So say what is this place? So I think it was a mistake. So we were at here. So choose this and insert one citation. So this citation is inserted here. And also it would be added here as well. So this way you will add your citations. Our next step is paraphrasing. So how to write? You don't have to read your paper and make your own wording. You can just paraphrase the results. You just have to change the wording of the results so that it does not have plagiarism. For which one software is Quillboard. Other than that, you can use any AI or chat GPT as well. So you would go to paraphrasing tool, and then, for example, you are reading this article and you want to cite this line that no patient became completely migraine free during the treatment. Then you would copy this line or any results. For example, MMD and MST were significantly reduced compared to baseline. So you would copy this line and write it here. For example, I'm not able to copy from Microsoft. So, for example, you are taking this line from this some article. You would copy it and paste it here and paraphrase. So in paraphrasing, it would just change the wording with the same result, and then you can paste it in your article wherever you are studying, wherever you're writing a discussion section. You can paste it here, and after pasting, you would give the reference of that article where you took that line from. And then in the second study, you would see that, um, for example, second study says that a significant number of patients with medication overuse discontinues the overused medication. You would write that line and then paraphrase it, and then write the paraphrase line here and then give the reference. This is how you would write your discussion section. So one by one, you would cite all the articles that you have selected under specific subheadings. And then when you have written your one section, for example, you wrote your conversion from chronic to episodic migraine. So in an Italian study, this number of patients transition from chronic to episodic migraine. You took this line, paraphrased it on Quillboard, pasted it here, and then put the reference of that article. And then in another study, you wrote the results, copy the results, paraphrase them on Quillboard, and then cite the article to Mendeley. And then in another study, you wrote the result here, and then paraphrase it, and then cite the article. Then you can also write your own conclusion after that. Now we have to check the plagiarism in this. After writing this paragraph, you can check the plagiarism. There are many paid plagiarism tools. You can also check it free. There is a site that is called duplichecker.com. You would paste it here and check plagiarism. You can also check grammar from here. This would take a little bit of time. This is scanning the plagiarism, and You can check your plagiarism from two different sites. I would share all the sites where you can check the plagiarism. If you would have any plagiarism, it would underline and then you can rephrase it and change the wording of that line. So this is how you would check the plagiarism. I would share other plagiarism tools as well. Because some websites are more reliable than others, so I will share all the plagiarism tools that you can use, and it's better if you at least check the plagiarism from two different sites. So this is how you would write the discussion section. Example, you would select studies that you would write your efficacy, and then you would start from the latest study. You would see the result, paraphrase it. You can use um, any other paraphrasing tool other than Quillbot as well. You can use any ChatGPT or AI tool as well for paraphrasing. So you would paraphrase the result and paste it here and then give the citation of that article. And then you would write the result of the second article, paraphrase it, change the wording, and then cite the article for third one, fourth one, sixth one. Analyze the studies, compare the studies at the end, and uh, give a conclusion at the end. And then you would go to the second subheading, similarly in third subheading, and then you would check the plagiarism after writing each paragraph, or you can do it after writing the whole discussion section. So, and so is limitations. And this is how you would write your results and discussion. In introduction, if you would have 8 to 15 articles, we would write the discussion introduction. In our next lecture, we would learn how to write introduction and conclusion and abstract in our next lecture. And then results and discussion would have 15 to 30 articles. It would have your articles that are your finalized articles, and you can also cite other sporting articles as well. So you should have less than 50 total articles. So this is your results and discussion section. We can revise it once. So we did method section. We are doing results and discussion. In next, we will do conclusion, introduction, and abstract. So in result, Prisma flow diagram, and then study characteristics and study outcomes, these two tables, and Prisma flow diagram is the result section. And before each table, you can write a summary in a paragraph of study characteristics and study outcomes. And then discussion section, you would choose the subheadings. You would choose the papers that you would write under those subheadings. And then you would these are the tables that you can add in your study characteristics in your result section. And then you would install Mendeley and download your selected articles, add them in Mendeley, and you would read each one of your paper. Under each subheading, you would paraphrase. You would take the result from paper one, paraphrase it, and write it in Word, and then give the citation by Mendeley. And then for the second paper, you would copy the results, paraphrase it, and then paste it and cite it to the reference manager. And similarly, for third article, you would paste the results, and then you can compare the results that all studies are towards the all studies shows the efficacy of a certain drug, or all studies shows the shows that there is no any improvement with this drug. If there is any heterogeneity means that a few papers say that the drug is efficacious and few papers say that drug is not. So this is called heterogeneity. Then you can also discuss that this paper says this, but the other paper is opposite. And it can be because this study has less number of patients or more risk of bias. So you can also discuss about that. It would make your paper more better and more reliable. So subheadings, write the results of each paper and paraphrase them, cite them, and then check the through duplicate checker, you would check the plagiarism and organize your papers from latest to oldest. So this is how you would write your results and discussion section. If you find any difficulty in this, you can ask me anytime. Um, so okay, for now, goodbye, and hoping that you won't find it much difficult. Okay, thank you so much.